Today we are going to discuss about neuroblastoma. Any idea? So neuroblastoma is a type of cancer that arises from the nerve vessels. So nerve vessels are our whole body to migrate throughout our body and mainly in the spinal cord and the spinal nerve on both sides of the spinal cord. Nerve vessels. So immature nerve vessels will aggregate in any of the part of our human body, and that is called as neuroblastoma. And other tumors are the change. The immature nerve vessels aggregate in any part of the body, rather majorly some part of the body, and affect the nerves, and it may immature nerve vessels will aggregate in any one part of the body or some parts of the body, and it will convert into the tumor cells. Another tumors is what? Aggregation of some cells. Another cluster of cells grow out, that is called as tumors. Cancer cells. So likewise, in the nerve vessels, the spine or spinal region, the spinal nerves or nerve cells are the nerve vessels. It is mostly found in infants or sometimes in the child's above or below the age of average of 5 years, and mostly was found in the infants. Infants are newborn babies. So in the newborn babies only we may find the immature cells. Okay, so this mostly will be found in the sympathetic chain ganglia in both sides of the spine and spinal nerves, spinal cord and the spinal nerves, and in the adrenal medulla, this adrenal gland, adrenal medulla, this nerve vessels will be formed. Okay, and these immature cells not only in the spinal cord, adrenal medulla, it also forms in the abdomen of the newborn babies, chest of the newborn babies, and neck of the newborn babies, and also sometimes in the bones or bone marrows, and it may damage the bone marrows. And abdominal, how can we diagnose with the result present in the abdominal solution? Through abdominal scan or CT scan, and the symptoms may swelling in the abdomen. Abdominal swelling in this appearance, if we diagnose, sometimes it may related to the nerve vessels damage or immature cells aggregate in the abdominal portion. Likewise, in the abdomen means this abnormality is happening to gene mutation sometimes, or the abnormal cell growth is due to the mutation in growth regulating hormones like MYC, ACK, FOX2B, growth hormones for the infants. In the mutation, in the growth hormones, if as deficiency appears, this immature cells will grow out of the chances in there. And coming to the so coming to the clinical manifestations and the symptoms, maybe it is chest appears, chest cells grow out. What will happen is breathing trouble will be getting other the baby or the 5-year-old child or someone who is affected with this neuroblastoma, they will be having the breathing difficulty, and abdominal pain and urinary bladder and bowel movement will be getting affected. And if it is in the neck, they will be affected with corner syndrome collectively. They will be having small pupils or one side eyelid with the low side of the gum, or sometimes only one side of the face will be getting sweaty. This is collectively called as corner syndrome. When it is affected, it means the nerve vessels accumulated in the neck region. And sometimes bones were, sometimes it may get affected. Up and down, bones will be getting more brittle, and even they are having the risk factors of fractures. Okay, and their bone marrow begins to get affected. Coming to the diagnosis part, lab it is they hormone test that is sympathetic hormones, adrenal metabolism, adrenal acid, hormonal test. Okay, due to this, if there are hormones or deficiency, then they will conclude that we are having neuroblastoma. And urine test and abdominal CT scan. The newborn baby or infant is having swelling of his abdominal scanner or ultrasound, and CBC, complete blood report against one. Okay, they will take blood test, the complete blood report, and PET scan, MIEG. These are the diagnosis for the neuroblastoma. And coming to the treatment part. For cancer adrenal, we will be having only chemotherapy, radiotherapy, and surgery. Sometimes, if it is heavy, others in some infants, neuroblastoma will occur and it will go by their own way. Under observation, it will go, or sometimes they will be giving the medicine, the pharmacological treatment. They will be giving the drug so when they are getting, it will go by their own way. But sometimes there is no other option. If it is heavier or it is seen in the 5-year-old child or something, they want to undergo chemotherapy followed by sometimes surgery followed by chemotherapy followed by radiotherapy. Okay, so this is the treatment for the neuroblastoma.